Recently, Prime Minister Justin Trudeau was asked why it's taking so long for Canadians to get tested for the COVID-19 virus, and here's what he had to say.
What's holding up Health Canada from approving serologic antibody testing? Apparently kits made in Canada are being used in the United States. And I guess more widely, what's keeping Canada from adopting a policy of rapid wide-scale testing to try to get this under control?
As I've said over the past many weeks, rapid, wide-scale testing is an essential part of controlling the spread of this virus. Canada is doing very well compared to many, many countries around the world in terms of the amount of tests that we're doing, but we know we can and we should be doing even better.
Oh yeah, we can do better, all right. In fact, folks, what would you say about a COVID-19 test that has been proven accurate on more than 100 million people so far? A test that takes a fraction of the time the traditional test requires, and a test that costs a fraction of the amount that the traditional test costs. Sounds far-fetched? Well, actually, no. Such a test exists, and it has even been approved by several medical authorities, but not Health Canada, at least not yet. But enough talk. Let's meet the man who can import these test kits into Canada tomorrow if need be. And what's more, I've offered up myself as a guinea pig to get tested on camera just so we can get a clear idea how this test actually works. Watch and see my results. Okay, folks, we're in the Rebel News boardroom, and now is the moment of truth. Is this COVID-19 test going to work? And who's the guinea pig? Well, you got one real big fat guinea pig. It's me, of course, and Nathan Jacobson, our international businessman who has a solution to basically eradicating the backlog of people that want testing. He is going to administer the test. And Nathan, can you tell me what exactly are you going to do to me right now?
Okay, first of all, I want, David, this is a test that's actually being used in China, in Wuhan. And it's a test responsible for putting Wuhan back working. There's been over 150 million of these tests that have been successfully implemented on the people. The majority of the tests that you see out there, the swab test, which is a very uncomfortable test where you have a Q-tip put up your nose, they do a swab, they put it in a tube, they label it, they package it, they send it off to a laboratory, sometimes in Winnipeg. And anywhere from 4 to 7 days later, they have a response on what the person has. Often, because the swab tests have a 20 to 60% or higher false read. So it's not accurate because they're testing for coronavirus. There's about 100 different coronaviruses, including the common flu, including MERS, SARS, all kinds of things. This is a test specifically for COVID-19, developed in China by a Chinese scientist who is working with us in our facilities, manufacturing currently today 1 million tests a day, and we can increase that volume as necessary. Another key thing about the test, and then I'll administer it to you. Another key thing about the test is you have the result in approximately 3 minutes, and this is what the test looks like. We're going to put a drop of your blood in here and 2 drops of the solution in here. There's 3 potential readings that you can get. M is you are infected with COVID-19. G, which is, I think it should be for great, it means you have been infected with COVID-19. You are now clear of the virus. You have the antibody, which means you can go to work, or first responders can go to work. Doctors can, nurses can. You should have ambulance people who have tested G as clear. It puts them back to work. It can help put the country back to work. And C is you don't have anything.
Well, you know, Nathan, you said this has already been administered 150 million times. Have various health authorities around the world actually approved this test as being bona fide in terms of screening for COVID-19?
We're allowed by the FDA to sell our product in the United States.
Oh, okay, so that means it's It's good with them.
It can be sold in the United States.
No, we just have to wait to see how Canada proceeds on this to get this into Canadian hospitals.
One would hope that the Canadians would recognize, A, the number of tests that have been successfully used, the fact that it's ISO compliant, the fact that the Europeans have approved it, the fact that we're allowed to sell it in the United States. Certain medical or scientific professionals, because they've been using something else, whether it's right or not, they have a propensity to defend it. And, you know, we give them credit. Guys, this is the best that you've had. But here's a real test specific to COVID-19. This is something that is so critical that should, and so proven, that it should not go to the bureaucrats to sit and say, well, we need months to test, because the only people that are benefiting through that are the coffin manufacturers. We've got to put our country back to work.
Now, Nathan, certainly your test kills the traditional test in terms of the timeline. It's a matter of minutes versus several days. But in terms of cost, what are we talking about on a per unit cost to have people tested?
The tests are being sold at under $25 a test. They're affordable.
So that's amazing, because right now the traditional test, as you said, on the low end, it's around $70 and it can go into the hundreds. So it's about a third of the low end of the traditional test.
As well as the fact that you're not getting a result in days, yes. You're getting a result literally in minutes.
We just have to wait to see how Canada proceeds on this to get this into Canadian hospitals.
One would hope that the Canadians would recognize, A, the number of tests that have been successfully used, the fact that it's ISO compliant, the fact that the Europeans have approved it, the fact that we're allowed to sell it in the United States. By every day I'm reading 10, 20 in Canada, people dying in the seniors' homes, but the seniors are also being denied their support group of their family. So first of all the seniors should be tested, and those that have the COVID-19 virus should be isolated. Those that don't should be kept under a regular thing, but also imagine what they're missing is their family being able to visit them. A person's a senior, maybe suffering from dementia or just being old and lonely. So outside the senior's home, a person could be tested, and 3 minutes later, we know that they can go and be with their father or mother.
Wow. So if everything you're saying is true, then, Nathan, I can't seem to find a downside in this. It's been tried over 150 million times, like you said. Various health authorities around the world have approved it. The timeline, it kills the traditional test. In terms of the finances, it's far more economical. So I guess it's just a matter of getting the bureaucrats on side. But before we get to that angle, you are indeed going to test me right here and now. Okay, then.
I hope you're not squeamish.
Well, you know, a little bit.
It's going to be very simple. It's going to be very much like what diabetics do daily. Okay. Give me a finger. Give me a finger. I'm going to clean your finger.
Okay. You know, folks, this reminds me of the blood test scene in John Carpenter's 1982 movie, The Thing. Remember how that turned out?
Okay, I'm going to take
please give me a negative.
This is the length of the pin. Okay. I'm going to stick you. That hurt a great deal. I could see you crying. I'm going to take some blood.
Okay.
I'm going to put that blood in here.
Wow.
So we've just done the most dangerous part. We can see that you're crying. we have a drop of blood in here. I'm putting 2 drops. And now...
That's the solution you put in.
The solution. Okay. And now you see there's going to be a line going up. I can tell you already, you don't have the coronavirus because we have passed the M. It's now up at the G. The line is moving up here. It's going to move up here. It's already past the G, which means you haven't had the virus and are now clear. Okay. It's approaching the C.
And C means what again, Nathan?
C means you do not have COVID-19. You see a bar coming across against the C, which means, David Menzies, you do not have the COVID virus. The actual test, which, 4 to 7 to 10 days to get a response, is I've heard that it's costing the governments up to $400 per test to get the results. A friend of mine in a western province was bragging because they're doing the tests in their province. They've got it down to $70.
Well, Nathan, this was absolutely fascinating. Thank you so much for coming down to Rebel News headquarters. You've made me a very happy man. I am healthy and I'm clear. And I guess right now we've just got to keep on the health authorities when they are going to approve this and get this into hospitals and doctors' offices, because this is a potential lifesaver and it doesn't deserve to be put on a shelf to go through the whole paralysis by analysis. Yes, they got to make sure it works, but once they know it works, let's get this to market as fast as possible. For Rebel News, I'm David the Menzoid Menzies. Hey folks, you know we don't receive a single nickel from the Trudeau Liberals, nor would we ask for such money if offered. We depend on you, our viewers, so please go to helprebelnews.com. That's helprebelnews.com. and keep Rebel News going so we can continue to bring you the other side of the story.